The 3,693rd death is 96-year-old female from Morgan County. The 3,694th death, an 81-year-old male from Boone County. The 3,695th death, an 84-year-old female from Ohio County. The 3,696th death, an 89-year-old male from Fayette County. The 3,697th death, a 91-year-old female from Mason County. The 3,698th death, a 56-year-old male from Fayette County. The 3,699th death, a 50-year-old female from Harrison County. The 3,700th death in West Virginia is a 67-year-old female from Greenbrier County. The 3,701st death is a 55-year-old female from Braxton County. The 3,702nd death is a 71-year-old male from Marion County. The 3,703rd death is a 47-year-old male. The 3,703rd death is a 47-year-old male from Randolph County. The 3,704th death is an 86-year-old female from Marshall County. The 3,705th death is a 67-year-old female from Mercer County. The 3,706th death is a 61-year-old male from Taylor County. The 3,707th death is a 60-year-old male from Ritchie County. The 3,708th death is a 74-year-old female from Tucker County. The 3,709th death is The 3,709th death in West Virginia is a 30-year-old male from Wetzel County. Younger than both of my children. Hard to believe. Hard to believe. The 3,710th death is an 81-year-old female from Randolph County. The 3,711th death is a 79-year-old male from Monroe County. The 3,712th death is an 85-year-old male from Pleasants County. The 3,713th death is a 78-year-old male from Kanawha County. The 3,714th death is a 58-year-old male from Kanawha County. The 3,715th death is a 72-year-old male from Randolph County. The 3,716th death is a 72-year-old female from Lincoln County. The 3,717th death is a 60-year-old female from Roane County. The 3,718th death is an 82-year-old female from Wetzel County. The 3,719th death is a 60-year-old female from Barber County. The 3,720th death is a 95-year-old female from Braxton County. The 3,721st death is a 75-year-old female from Mercer County. And the 3,722nd death in West Virginia is an 81-year-old male from Cabell County. Please, West Virginia, please get vaccinated. And please, West Virginia, keep these people in your prayers. We can send up lots and lots of prayers if you don't know any of them, and if you know them, please call them, or please go see them. Please don't let them be alone, and please don't let them become a number. Our active cases are now at 13,344. No, wait, we've got a change in that. You know, they're really at 14,014. 14,014. And our positive cases are at 1,645. Our daily positivity rate is at 10.6. A cumulative rate is now at 5.9. We got a bunch of people that have recovered, 200 and almost 25,000 people. But really and truly, our new positive cases are still holding about the same. I'd say, instead of thinking that from the surge standpoint, I do believe we're at the peak of the surge, just like being in the eye of the hurricane. But I really believe that there's a really good chance that we're going to start down, but we really haven't started down yet. We're still really just hanging right in there, right at the peak. There's no guarantee, is there? There's no guarantee that maybe, just maybe, we just pause a second and go even higher. But I really believe what we're doing is we're going through this pause and we'll start to fall off. We've lost way too many people. The number of hospitalized are 958. The number in the ICU units is 269, and the number on ventilators is 172. Now, all three of those are down just a little teeny bit. But really, and I hate to say anything like this, but we all know we're going to continue to lose people, aren't we? And to be perfectly honest, we're going to probably still lose a lot of people. The only way we can stop it is what I've told you, and I've told you and told you and told you and told you. The only way in the world we're going to stop this is to get vaccinated. And for those that have been fully vaccinated, that are out now, over 6 months, you've got to go get that booster shot. That's all there is to it. We got 2 green counties. Pocahontas, I guess, has drifted into the yellow and everything. We've got 2 green counties. We've got a sprinkle of gold and yellow, but, we just got to stay right on top of it. Currently, there's 69 schools with outbreaks, 836 kids confirmed. We have 1 county, that's Pocahontas, that doesn't have the mask mandate, that's, from K through 12. Hospital numbers reflect over and over that the overwhelming majority of those folks that are in the hospital are unvaccinated, but the amount that are in the hospital that are vaccinated continues to creep up just a little bit. And what does it tell us? It tells us that the boosters, we've got to get the boosters. On a really great note, I want you all to join me in absolutely expressing the happiest birthday that we can extend to an American hero, to our own West Virginia hero, Woody Williams. And Woody, you are 98 years young today, and absolutely, if anybody has had the ability to listen to this great man speak, and think of the feats and what he has conquered in his life and achieved, it's unbelievable. It's totally unbelievable. But this man speaks as eloquently as you could possibly speak. Absolutely, Woody, happy birthday from me, from all this great state. We love you with all our soul, and we're so proud of you. So proud. Thank you so much again. Got some more good news. It's almost like this, we become immune to this. But really and truly, this takes lots of work and lots of people that are pitching a near perfect game. The month of September, the revenue numbers come in again, a whopping $84.6 million above estimate. It ought to be the number one thing that we think about in lots of ways. This state is killing it. That's all there is to it. We are doing absolutely fantastic, and they didn't get this way by just rolling off a log. I'll promise you didn't get this way by people not working. And I'll promise you that absolutely as we continue to go forward, we got more and more good to tell. This state is killing it, and absolutely the people that were over there at the mansion meeting with me just a little while ago, they know it. That's why they're looking at coming to West Virginia. There is so many bright spots about West Virginia, and we need to tell our story. We need to tell the story of just how great West Virginia is doing and how West Virginia has really changed. As we continue to go forward, we've got still people out there that are hurting. We want to continue to flip every rock until all of us are running through the finish line together. So I'm not going to go through all the little bits and pieces and tell you everything. I will tell you that the consumer sales tax is significantly up. Severance tax are up. Severance tax are up 156%. And way to go from the standpoint of our coal and our oil and our gas. The only thing I would say there, we missed a real opportunity in not tiering our severance tax, because I don't think that this would have hurt our companies in any way, and it would surely have helped West Virginia an awful lot. Our corporate net income tax up 60.5%. It's amazing. Sales tax up 7.5%. Personal income tax up 11.6%. It's unbelievable. Unbelievable. So way to go. Way to go, all you out there in West Virginia land and everything, and all the people that make these licks happen and work with me each and every day. So way to go. Couldn't be more proud. Okay, back to COVID stuff. I want to be sure and remind those over 65, as I do all the time, if you feel the least bit funny, get tested. Antibodies are waiting on you, and they'll save your life. I want to read this morning about a letter to the president, that I signed a letter to President Biden requesting that he approve our request for more antibody doses. We need them, and we're not getting as many as we would like to get and everything, but we're working hard as we can to get those doses, and General Hoyer will tell you more about this. I encourage you to wear a mask if you're going inside to a big crowd and you've got any compromising health issues and everything, and you're over the age of 50 or 60 or 65, absolutely think about it. Just think about it. You may very well need to be wearing a mask indoors in a big crowd if you're compromised in any way. Now, the other thing is this, from the booster vaccines, I've been through it over and over. Just listen to the docs and listen to all the medical team and all the medical experts. Listen to the Johns Hopkins doc. The guy that's head of infectious disease, what did he say? Absolutely, hands down, those that have had the Pfizer vaccine, as the others do also, but the Pfizer vaccine substantially drops off after 6 months. You got to go get that booster shot. And if you're 18 and above, get with it. Go get that booster shot. We've got all the Pfizer we need to keep up with that. We're ready to go. The whole deal is just this. West Virginia, you led the nation. You jumped out and led the entire nation in getting vaccinated. You did. Now, come on. We need you to lead the nation again with the booster shots. So run and get that taken care of. Numbers real quick. Now we've got 92% of the people that are 65 and older with one dose. We've got 80.1% 50 and older with one dose. Can't be better. Can't be better than that. That's all there is to it. That's great. We're going to continue to try to grow that number and everything. We have 64.7% of our population that's 12 and older with the one shot, and we got to get more. Now let me show you something that's really telltale the whole thing. From 12 and above, we're at 64.7. From 18 and above, we're at 66.2. I'll promise you the difference between 12 and 18, we're not getting very many people of our people vaccinated. We got to bump that up. We got to really bump that up. And from 18 all the way up to 50, we're 66 to 80. That's where the shortfalls are. The shortfalls are with our young people. We got to bump it up. We only had 3,100 people get vaccinated since the last time I was here, and really and truly, it's not enough. It's just not enough. I wish you could listen to the general when he's unscripted, because I'll promise you he'd tell you just as straight up, and I'll tell you too, absolutely 3,100 doses is not enough. And absolutely, if you want me to roll in here with the death lottery and read 80 names or whatever it may be, and you could very well be one of them, or one of your loved ones that you love so dearly could be one of them. Absolutely. Do you want me to continue to read 80 West Virginians every other day that we've lost in this state? You can stop it. You can stop it, just like I've said. I think I think we've done enough on the giveaways we did yesterday from the standpoint of the Upshur County, County Superintendent, Dr. Sarah Lewis Stankus, Upshur County, and my wife Kathy talked an awful lot about her, before I went up there. She said, "You won't believe it. You won't believe how great this school is and how great that county's going on and everything." The county has communities and schools now, and that's going great there. So Kathy's had the opportunity to visit up there and everything. But she said this superintendent's killing it. She said she's doing a fabulous job and everything. And so, Dr. Stankus, I thank you, and sorry I probably mispronounced your name first time. And she wrote a really nice thing, about me and about Baby Dog and about being there and everything. And well, I'm gonna read it to you. It won't take a second. We are so impressed that our governor is committed to the vaccination and safety of the individuals in our state, and he is taking time from his very busy schedule to personally deliver scholarships to the students at Upshur County High School. At Buchanan Upshur, in Upshur County. Having 3 scholarship winners at Buchanan Upshur High is beyond our imagination. What a blessing to the families and students, and boy, that's for real. Really and truly, this, in a lot of situations, we had the feedback that, my child just couldn't do it. Wanting to go to school, just couldn't pull it off and everything. And it says, and Baby Dog was the star of the day. And again, thanks to the governor for his personal touch and everything. You don't need to thank me. You don't need to thank me at all. Really and truly, at the end of the day, I thank all those because I love being with the kids. They are just absolutely so fantastic. And I urge anybody and everybody. So what? You got to work a little harder. We've all got our day job. For crying out loud, so what? You got to work a little harder. You can't imagine the energy that these kids will give you back if you'll just take time to volunteer and be with them in any way. Just don't talk about it. Don't stand on the sidelines and say, oh, I'm for the kids and everything, but I just really don't have enough time to do that. You do. It's hard. It's not easy. Yesterday, I was in Lewisburg yesterday morning before we left, and think about this. I drove to Charleston, drove to GW, drove to Weston, left there, went to Philip Barber, drove to Morgantown, and drove home. You can do it. But you just got to work a little harder. Okay, the vaccine eligibility 12 and older, I encourage our parents, grandparents to help me get everybody across the finish line and get these kids vaccinated. I said and told these kids yesterday, the worst of it all is this. These kids could be spreading it all over the place. They could absolutely not even know they got it. But it could turn up with some level of side effect, and I don't scare anybody. All I do is tell you the truth. It could turn up with some level of side effect that could plague these children for a long, long time to come. You got to get them vaccinated, everybody. You got to get them vaccinated. Our grand families take advantage of this $150 voucher. All the COVID stuff is up on our info line. The free testing's everywhere. Frith and Walgreens, thanks. All the time I thank you. We have 73 outbreaks. We only have 1 outbreak in our church community. That's really great stuff, and that's in Wayne County. We have 234 inmates at 15 facilities and 58 staff cases at 15 facilities. We've checked and everything as far as at corrections. If you want to get a vaccine and everything, we're standing ready, from what I've been told, to give it to you. There is no way under the sun that we're holding back, vaccinations to anybody in corrections, and at least that's what I've been told. And I'd be grossly disappointed if I'm told anything but the truth. And so we're trying every way under the sun to get these shots in people's arms. I encourage you about giving blood. We are absolutely, one of the people in our meeting today at the mansion this morning was Albert Wright with WVU, and what a job with WVU medicine that Albert's done. He's doing a great job every day, and they're just growing leaps and bounds. And he knows, and I know too, that we're standing in the wings ready to help with the hospitals and everything to assure that we protect those hospitals. We protect them like crazy because they're our lifeblood in every way, and we have got to protect them for our people and everything. We'll stand behind them and try to help them economically or anything we can possibly do. I am proclaiming October as a Cyber Security Awareness Month in West Virginia. This month we will be partnering with the U.S. Department of Homeland Security to bring awareness to cyber threats and internet safety measures. I proudly signed this Secure West Virginia Act into law in 2019, which creates the framework for managing cybersecurity risk and enhancing cybersecurity in our state. And Jeff Sandy and all of his people and all those that are working in all these areas, from law enforcement right on down, thanks. You're doing a great job. Great job. We just received from our senators this week, from our U.S. senators, that West Virginia, or we were told that West Virginia will be securing a $24 million grant from the U.S. Department of Education for the West Virginia Higher Education Policies Commission's Gear Up program. That's great stuff, and it's just going to support our students in some of our most rural counties, by helping them plan for college or career training, how they can move forward. So again, special thanks to our senators and everything. It's good work, great stuff that's happening. Oh my gosh, I'm going to be on Face the Nation on Sunday morning at 10:30, and I'm going to be trying to praise West Virginia and send out more and more positive stuff all across this nation, or try to as best I possibly can. If they'll allow me to do so, because West Virginia is doing absolutely wonderful, and we want more and more people to come. That's all there is to it. Last thing I have is flu shot. Take a flu shot. You got to do it. You can take the flu shot and the COVID shot at the same time, and you need to do that. Bad weather's coming. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. Just to touch on a couple of current topics in the COVID-19 pandemic. Merck announced a new oral drug, molnupiravir, that has been shown in clinical trials to be effective in preventing severe consequences, hospitalizations, and death in people that have mild to moderate COVID-19, which means, just like with the antibodies, these are people that don't require supplemental oxygen or are in the hospital. And this is really exciting because we know that the antibodies that we infuse can reduce the risk of being hospitalized in people at risk who have COVID-19 by about 80%. This oral drug, that is 2 pills a day for 5 days, I believe, has an ability to reduce the risk of hospitalization in the clinical trial that was just completed, as reported, by 50%. So even though it's a little bit less effective than the antibodies, still really good, and reduce the risk of death to 0 in the 29 days in which 775 people who were part of the clinical trial participated. So this is another exciting tool that we very well may get in our tool belt, and this might be able to augment the use of the monoclonal antibodies in people at risk. In addition, the CDC reports very clear data that, that vaccination in pregnant women is both safe and really important. Only about a third of women who are pregnant in our country are fully vaccinated, and the CDC has been very intentional in making sure that they message that all women who are pregnant should consider getting mRNA vaccination, which is Pfizer or Moderna. And we know that the rate of miscarriages or other problems with pregnancy is not affected by these vaccinations, but the protection for mom and baby are pretty significant, and risk of preterm labor and other problems of pregnancy go up with COVID-19 infections. And as the governor said, we know that the uptake of the vaccines in younger people has not nearly been what we hope it will be. And as we start to look now at the potential that the dosing for 5 to 11-year-olds, at least with the Pfizer vaccine, will be given emergency use authorization, we believe, relatively soon by the Food and Drug Administration, and would then anticipate the same by the CDC, that early data says about a third of parents think now that they will immunize their children, about a third are considering it, and about a quarter are not in favor of it. And this is just another opportunity for us to not only make sure we're protecting our children and our schools by having our children vaccinated, but really these are the steps that we all need to take to get to the end of the COVID pandemic. And just one other note, the governor has, I think, very wisely talked daily about where we are with this current surge of the Delta variant of COVID-19. And what we know is that we see a lot of indicators that would say that, as the governor said, we are either right at the top or we're starting to come down a little bit. But obviously, we know that the virus is dictating to us what happens next. And so it's still really important for people to get vaccinated if you haven't. We know from data from Israel that having boosters uptaken by people who are greater than 6 months out from their second Pfizer vaccine has dramatically reduced the number of severe infections in people who have been vaccinated, and has also reduced the spread of COVID-19 in Israel. So it's really important for us to do that. And all the data says that the side effects of the third boost for people that have had the Pfizer vaccine are no worse than the previous vaccinations. So thank you very much.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Thank you. As the governor pointed out, he has sent an additional correspondence to the president related to additional antibodies. What I can update you on today is that we continue to ask for, and we have demonstrated the demand for 3,000 doses. Unfortunately, last week we got 1,368 of the Regeneron doses, and we were scheduled to get 1,584 doses of Regeneron this week, but to date we have only received 156. That is due to a national supply issue. As many of you may have heard in the press earlier in the last couple of weeks, 7 states with very low vaccination rates have consumed over 70% of the antibody doses in the country. AmerisourceBergen announced today that there was a supply chain challenge. We are continuing to work it, not just daily, but hourly. We are also moving where available antibodies, the intravenous antibodies that we have in our hospitals across the state, to various locations where we need to get doses into people who need them right away. We will continue to work that effort throughout the weekend, and the governor and his team will continue to press to get more antibodies in the state. But right now it is a national supply chain issue related to booster doses and additional doses, and those getting first doses. Just to give people a benchmark, while there is a lag in reporting that comes up, so you look on the dashboard, you may see a certain number of third doses or booster doses that go in that are combined together. But the benchmark that we look at is how many doses are we pushing out to the counties, to our county partners and the teams in those counties. So just to give you some perspective, last week we pushed out 15,000 doses from our central hubs. This week we pushed out 33,000 doses from our central hubs. So clearly more doses are going out. More booster doses are going in arms throughout this time period. We also hope that some of those are first doses. As the governor pointed out, while we have reached 66.2% of the 18 plus population, as I've said before, it's just not fast enough. We've got to continue to pick this up. I appreciate the information Dr. Marsh gave us on the new Merck drug, but I guess I put it in these terms for my fellow West Virginians. Back in the early 1980s, I went to airborne school to become a paratrooper, if I was going through the line to get my parachute, and they said, Hoyer, you can have the one that may work 50% of the time, or you can have the one that works 99+ percent of the time. I'm going to want that one. And that's the vaccine. And the governor and all of us have pointed out before, we'll continue to probably have antibody shortage supplies. This new drug maybe helps you 50% of the time, but we know the vaccine works. And we know when you get your booster shot on the Pfizer, the vaccine works. So West Virginia, you've got to get vaccinated. And I would leave you with this. I'll take a point of privilege to, as the governor did, to wish my good friend and someone who's been a mentor for me throughout my time in the leadership of the National Guard, a great American. I call him a national treasure. And that's Woody Williams, not just for the heroic actions at Iwo Jima that led to the Congressional Medal of Honor, but for the work that he's done tirelessly since he left the service and became a part of the VA and a veterans advocate for all of his life, and all he's done for our Gold Star families, particularly our Gold Star mothers. And lastly, on Sunday is my wife's birthday. And I want to wish her happy birthday and thank her. I would not be able to do the work I do with the governor and the interagency task force, and now with the university, or my almost 40 years of military service, without her support and love and care and all the things that she's done to allow me to continue to do the work for you, West Virginia. So happy birthday to both Woody and Amy. Thank you.
All right, thank you, sir. Dr. Ainamjad and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. General Hoyer, could you give us an update on the effort to get our nursing home populations, the booster shots? You said earlier in the week that we were going to be close to being done by the end of this week, but that was going to continue into next week. Where are we at? About how many facilities do we have left at this point, sir?
General, please go. And happy birthday, Amy, too.
Thank you, Governor. So, Charles, in an update from Marty Wright with the nursing home owners, we are still on track for early next week. I don't have an exact number of facilities right at the moment that have completed, but I will on Monday and Wednesday's press conference have those updated final numbers on the Pfizer vaccine. And again, remember, this is just the Pfizer vaccine. We're still waiting for approval on Moderna, and approximately 75% of the residents and staff from nursing home facilities were given the Moderna dose, as you remember, because at the time, with the temperature control issues that we had to manage, that was the best option that we had particularly for our rural facilities. Thank you.
Thank you, Charles. Next to Mark Curtis with Next Star Media.
Yeah, I want to go back to the good afternoon, Governor and staff, and happy birthday, Woody Williams. My Uncle Barney fought with him at Iwo Jima in that famous battle, and so congratulations and happy birthday, Amy Hoyer, as well. I want to drill down a little bit on this monoclonal shortage. Because the 7 states that they're blaming this on are all clearly red states: Alabama, Florida, Texas, Mississippi, Tennessee, Georgia, and Louisiana. Obviously, West Virginia now is a state that leans red. Are you concerned at all, Governor, or anybody else that wants to weigh in, that people in Washington are playing politics with this and maybe distributing monoclonal antibodies to states that are a little bit more friendly to the party in power?
Mark, what else do those people in Washington do? That's all they do. It's all politics. You know, I hate to say it makes me sick. That's all there is to it. You know, all they do is divide us And absolutely, it's just politics after politics after politics. And really, really and truly, should we not be way more concerned about people's lives and all the different things that we have right at our fingertips right now? I mean, what in the world? I mean, literally, I don't know how anybody, I mean, we can go on with an answer and everything, but of course it's politics. Of course it is, you know, and it's disgraceful. But I can't say more than that.
All right, thank you, Mark. Next to David Beard with the Dominion Post.
Well, hi. I was going to ask about the Merck pill, and Dr. Marsh answered most of my question, but I'll ask in addition to what he said. Do we have any estimates on how far along they are in the trials? When they might submit their data to the FDA? Would they be seeking an EUA to get it rolling out as soon as possible? And is there any projected timeline for getting that out to the public from all that? That's a lot of ifs. So anything you can say to help would be great. Thanks.
Dr. Marsh, please.
Thank you, Governor, and thank you, David. So the clinical trial that was ongoing was set to enroll over 1,000 patients, but the data monitoring board that oversees the clinical trial determined that at 775 patients, I believe, that the results were so striking that they should stop the trial. And the results were very striking in favor of the benefit of the pill. And this is a pill that blocks some of the ability of the virus to replicate, kind of like the remdesivir, the antiviral agent. But it works in people who are not hospitalized and not on oxygen, and really the same way that we use the monoclonal antibodies. But because this is in pill form, it will, presuming that the data that the FDA and the CDC see is also equally as valid as what's being reported, that it would be an advance because it would be able to be prescribed on an outpatient basis, and you pick up pills in a pharmacy and you take them by mouth, which would be a lot easier. Now remember, the benefit though is about 50% reduction in hospitalization versus the monoclonal antibodies, which are about 80% reduction, same population of hospitalization. Importantly though, in this trial of the people, as all the people had COVID in the trial, that 8 people that got the non-treatment, didn't get the pill with the drug, died, and nobody died in the get the drug. So that's very, very encouraging that we would have another pill. I think Jim Hoyer said it though well. This is not a substitute, nor should it be seen for full vaccination, but to allow us to help people more, this is a really good thing. The company is advancing these results, as I understand it, to the FDA. And so the presumption is the FDA will look at these results, make sure that they are sufficient, and then make a ruling on what they believe. And as we've seen before, they would use likely an emergency use authorization and then pass it to the CDC so that the Advisory Committee on Immunization Practices will respond. And from what it sounds like, my guess would be in the next month to 2 months, we would start to see activity on this, and hopefully this will turn out to be another effective, tool in our belt. But as again, just to reinforce, not as good as full vaccination. So this should be seen as an ancillary treatment for people who need it, but we still very highly encourage everybody to get fully vaccinated. And for those who are 6 months out from the Pfizer primary dosage, who are over 18 years old, to get boosters. Thank you.
All right, thank you, David. Next to Paul Mullen with WCBC.
Good afternoon, Governor and panel, and happy Friday, everybody. I want to talk about the flu and the potential for a bad flu season. Last year, we didn't have much of a flu season. Was that because everybody was masked up and social distancing and all that? Or are we looking for a more virulent flu season this year with a bad strain coming our way? Is there any explanation on why this year other than the mask and all, would be worse than last year? Thank you.
Dr. Amjad, I guess this is you and everything, and we'd sure like to hear from you. But at the same time, you know, Paul, I'm as sure as I can possibly be from working with all the medical teams and everything. The mask sure had an impact. The social distancing had an impact. You know, maybe we just didn't catch as bad a season last year, and the good Lord's trying to look after us. But as I know he does. But anyway, Dr. Amjad, answer that, please.
Yes, Governor. Paul, I think all of the stuff that we did last year had an impact on the flu season. So social distancing, hand washing, people were using the hand gels a lot more. The masks did help as well. I think a lot of people last year were more conscious about, we'll say, hygiene in general. So I think that helped. I think a lot of people also got the flu vaccine last year. So all of those things combined, I think, is one reason we didn't see a lot of flu activity last year. People were more just self-aware of, you know, catching a respiratory disease, I think, and people were self-isolating more. They were not out and about doing things that they normally would. We also know that people were not in school a lot more. People were not traveling as much, and things that normally spread diseases, even like the flu. So a combination of all that contributed to that. Hopefully this year, people are going to get their flu vaccine along with the COVID vaccine. So we're really hoping we don't see a high flu season this year as well. Thanks.
All right, thank you, Paul. Next to Evan Bevins with Ogden Newspapers.
Thank you. Governor, I wanted to follow up on a couple of things you said, make sure I was understanding correctly. I think earlier you mentioned if you're 18 and above, go out and get the booster shot. I didn't know if that was directed at everybody or just those who were immunocompromised. And then earlier you referenced playing politics, and I wanted to clarify if that was in blaming certain states for the shortage or in the distribution of the antibodies. Thank you.
Well, Evan, let me do the last one, you know, first. You know, Evan, and I said this the other day, I think I said this on the briefing, you know, in regard to the, you know, shutting down the government. I said that'll never happen. You know, we were prepared here to take care of our National Guard and do that kind of stuff, and I said it'll never happen. You know, now we've got a wrangling going on with the infrastructure, or this social type infrastructure bill that the Democrats are pushing, you know, from the standpoint of, you know, $3.5 trillion. It's hard for me to even say that number, and the infrastructure bills, which is a trillion, you know, 200 billion or $1.5 trillion. Well, we all know the infrastructure of our nation is so important, it's unbelievable. It is unbelievably important. And we all know that there are some things probably within this this other bill that, you know, could be going through as far as the $3.5 trillion of social needs or whatever like that, you know, that they're important too. Now, to the magnitude of $3.5 trillion, well, there's no possible way. There's no possible way. From the standpoint of the magnitude of maybe a sprinkle of that, and I mean a sprinkle, yeah, that's probably real. But to take and hold up our infrastructure bill as hostage to that, is that not anything other than just typical nasty politics? And the reality of the whole thing is, the way I see it, is just this, is what's going to happen in both situations is this. You mark it down. We'll pass both. We'll water it down and pass both at the end of the day. I think that's the wrong thing to do. I think we need the infrastructure bill so badly it's off the chart. There are things, but I think ever so very, very, very small on the other side, and there are things that are very important that we absolutely should probably look at going forward. But with all of that, you know, at the end of the day, we're going to hold up and everything, and the net of the whole thing, and people aren't going to like me saying this, But why really are we pushing like crazy? If the truth were really known, why are we pushing a $3.5 trillion social bill? You know why we're doing that? Because the midterm election is staring us right down the barrel. And that is nothing but a money giveaway beyond belief, because we're concerned with the midterm election. And that's why we're holding up the infrastructure bill. It's a shame. It's a crying shame. And if you think for a second that, that we won't play politics with red states versus, getting the antibodies or whatever, I mean, if you think that we're above doing that, I've got some great oceanfront property in the middle of Kansas that I'd like to sell you, But at the end of the day, it's not good. It's not good that vote after vote after vote is, 50 Republicans vote one way, 50 Democrats vote another way, the vice president breaks the tie. It's not good that we can't have absolute bills go through to where we have our own opinions, granted. But we absolutely ought to have bills going through where we don't have just votes like that. It's a shame because it divides this nation, and we absolutely are not totally invincible forever. This nation is strong beyond all of our comprehensions. And that's how we've been able to survive, because we are absolutely strong beyond belief. But we're not invincible. And really and truly, we cannot continue to divide ourselves. We've got to some way reach out across party lines and say, first and foremost, we're all Americans. For crying out loud, it is absolutely silly to have us continue to fight and divide one another every day like we do. So the first part of the question, I've already, somebody, we're going to have to go back and tell me what the first part of the question was. I got off on that, and forgive me.
You had said earlier, encourage people, if you're 18 and above, get with it, go get that booster shot. Did that mean anybody 18 and above who had Pfizer, or is that specific to immunocompromised individuals?
I think it's anybody 18 and above. And the reason, and I think there's all kinds of different ways you can qualify, and Dr. Marsh and other people way smarter than I will be able to tell you that. But the net of the whole thing is just this, Evan, is if you're 18 and above and you got yourself fully vaccinated, well, you did it for a reason. You did it to protect yourself and to protect your loved ones. And the medical community is telling you if you're 6 months out, your protection level has dropped way off. And so if you decided to protect yourself and protect your loved ones and everything by getting vaccinated, you need to go get that booster shot. And you need to go right now. So that's I don't know how to be more clear, but thank you, Evan.
Yeah, thank you, Evan. Governor, I'll turn it back to you.
Okay, I just want to just say this, as we go forward, the announcement today from Merck was great news and a great promise. We want to continue to do anything and everything we can to get us through the finish line and get us through the finish line with less and less people that die. I've said it 1,000,000 times. No mandate on vaccination from my end will happen. No way. I do stand rock solid in everyone's freedom. But that doesn't mean that I can't try to educate and encourage all. Because without any question, the more we vaccinate, the less will die. It's tough. It's really tough to sit here and read 80 great West Virginians that we've lost. It's awful. A 30-year-old. It is awful to do this and everything and read through it, but it doesn't even compare to the level of absolute pain that those loved ones of these great people are going through right now. I want to stop this. I don't have any way to stop it other than you get vaccinated. No other way. I salute Merck, and I hope like crazy that all is going to work out there and everything in the months to come, and it gives us more and more ammunition. It's great stuff. Last of my last today. You know, when Sydney at GW grabbed a hold of me and just hugged me so tight, you know what that's all about? She needs more and more people that love her. But you know what else it's about? She gave me more and more energy to go. It's really important. Our kids are out there. It was a fabulous day yesterday to spend that time with the kids and encourage them, show them that we love them, show them we care about them and everything, and to thank all those that are putting in the licks every day. The teachers, the administration, the service personnel, and all those great people, I just thank them more than you'll know. So really and truly, for my day yesterday again, Sydney, thanks. You meant a lot to me yesterday, as well as all the other kids and all the people. So great day. We'll just keep at it. We're going to get through this, West Virginia. Thank you so much.